When we look at degenerative disc disease, one of the most common things that get asked is how does disc degeneration or disc disease occur? Now, the explanation of disc degeneration or degenerative disc disease, which is actually the true name, I believe is a complete misnomer, and it confuses patients on what they're actually having. When they look at disc disease, when you hear the word disease, you think it's something that's affecting your system, like a disease that you've acquired and you've caught and you have to fight the disease. And the truth is degenerative disc disease in the majority of cases has nothing to do with disease. It has everything to do with the alignment of your spine. So this is why I call it a misnomer. If we think of an unaligned car and we think of a car that's not in the proper alignment, and you're going to see one tire start to degenerate faster than the other 3 tires, you wouldn't say the car has a tire disease. You would say that the tire is deteriorating abnormally or faster because there's more weight bearing and more weight on it, and there's asymmetrical load. This is what degenerative disc disease is. It's more to do with alignment. Now, there are some causes of disc degeneration that is truly a disease, but very, very rare. This is not what they're talking about when they're talking about degenerative disc disease in the majority of cases. I mean, you're looking at 98% of all cases is because the spine is deteriorating abnormally because of weight bearing. And when you look at causes, the number one cause of degenerative disc disease is 100% spinal alignment. And when the spinal alignment remains in this abnormal position for a long period of time, what it causes is asymmetrical weight bearing into the discs and the bones, which will lead to a degenerative look on an X-ray or image. And it's not very hard to see, and it's pretty easy to explain. And I can use these models here to show you is that when you look at a normal spine, this is being the side view, and this is the vertebra, and these are the discs. And you can see that here the discs and the bones are in healthy shape. And I'll show you what an abnormal one looks like in a second. This is your disc material and these are your bones. And these discs are in between these vertebrae to act like kind of cushions for weight, or like a spacer. And this allows these discs to remain in the normal space and allow these nerves to kind of exit the spine, as you can see here, into the body. And that is what's sending information back and forth from your brain to your body back to your brain. Now, and when the spine that has degeneration in it, the most extreme version would be this one that we see over here. And you can see the disc has completely deteriorated and there's almost bone on bone. But this is a process. To go from what I showed you to this takes years and years and years, if not decades, to end up looking like this. What initially starts to occur in most cases is that because of the alignment, just like a tire, it will cause these discs to deteriorate and start wearing out faster than the other discs. And since the alignment and the disc starts to thin, we start getting degeneration that we start to see. These symptoms are very consistent when we look at disc degeneration. And the number one symptom is going to be typically loss of motion, mobility issues. It's normally going to be back pain and stiffness. And like I mentioned, radicular pain going to different parts of the body. Now, very often patients will have these symptoms and they'll go see doctors with pain, stiffness, and radicular types of symptoms, meaning numbness or radiating pain into their extremities, like arms or legs. And very often the pain is treated, meaning they're given pain medications, injections. They may be given exercises to improve flexibility, but the alignment isn't addressed. So if you have an unaligned car it's out of alignment and the tire is deteriorating, and you say, oh, well, I'm not going to worry about the alignment. I'm just going to change the tire. Right? I'm just going to change the tire, but I'm going to leave the car exactly the same way. Well, what's going to continue to occur? The tire will degenerate. In fact, you probably just brought a new tire for nothing because you're going to have to change it again. And the same thing is true with this, is that since they're not addressing the problem, what's causing it, they may help you a little bit with pain and discomfort. They may address some of the functional issues that are occurring, but since the alignment isn't addressed, the spine will continue to deteriorate, the disc will continue to deteriorate. So therefore, we must address what's causing the problem. And the true best treatment for degenerative disc disease is to restore normal alignment. Trying to restore normal alignment could have 2 different approaches when we look at it. And one of it is non-surgical approaches. And unfortunately, there are also surgical approaches which can have more long-term impacts on your health and well-being. Non-surgical approaches include things like chiropractic care, physical therapy, structural rehabilitation. And these things are done normally to help improve not only the mobility of the areas that are deteriorated, but also the alignment of those areas. A lot of times patients will be told, oh, you just have normal aging, like normal aging. And this can sometimes be true if the degeneration is up and down your entire spine, but it's not what we see. When we take x-rays and take images, what we see is one area is way more degenerative than the rest. And it can be related to maybe where you may have a scoliosis or a misalignment, and that area is degenerated more than the rest of your spine. So again, alignment is the most important thing. Now, when we look at surgical approaches, this can sometimes be tricky because a lot of times they can say, oh, your disc is so damaged and so degenerated that we have to remove the disc that you have there or cut part of the disc out, which can lead to another host of issues, which I'll explain in a second. But they'll cut the disc out and then they'll fuse it. Well, the minute they fuse those vertebrae, now they're affecting the alignment above and below that fusion, which is going to now lead the same cycle we just talked about. This will lead to more degeneration above and below and kind of kick the thing down the road and kind of spread the problem further than just that localized area that's been affected. Now, when we look at how it can cutting a part of the disc out, because a lot of patients will be recommended discectomy. They'll go in here and try to say, okay, this area is damaged or degenerated, and they'll just try to slice this disc. When you cut part of this disc out, you make the disc actually thinner. And one thing that you've noticed is in these discs is as they deteriorate, they get thinner. The thinner this becomes, the more likely you're going to have degeneration and damage in your spine. It's just like putting a smaller tire on one side of your car versus the other. The alignment's almost impossible to restore normally at this point. It's just going to lead to a more cyclic process that's going to occur, which is going to lead to more degeneration, more problems, more pain, and more discomfort. So how do we deal with it? So number one is we want to restore alignment. And two is now can we restore some of the degeneration that's actually happened to the disc? And the good news is yes, especially in early stages. In early stages of disc degeneration, when the disc is just kind of thinned, you can actually make a significant impact to disc health by restoring alignment, taking the pressure, abnormal pressure off the disc, using techniques and therapies and rehabilitations to actually restore some of the degeneration that's occurred, create hydration into the disc with very specific disc exercises and rehabilitation, and reverse some of it. However, if you have significant disc degeneration and bone degeneration like the one I mentioned here, this is very difficult to restore because it's so much damage. What we're trying to do in a case like that is prevent further damage and preserve the area and prevent it from affecting other areas by keeping the alignment and the disc as healthy as we can. So even though we can't reverse that amount of damage, we can definitely prevent it from further progressing and degenerating. So the idea with disc degeneration is the sooner you know you have it, the sooner you treat it, the sooner you restore the alignment and prevent what's causing it from worsening, the better chance your recovery will be, and the less likely it will affect your health and well-being as you age. I'm Dr. Naldo. Follow for more.